I think that all patients should have access to these therapies, and there's no way that's going to be only in academic centers. I don't think that necessarily every single doctor needs to have direct knowledge of this. They just need to be able to refer. And that's generally speaking what is, I'm not sure of the exact number, but let's say 95% of patients with metastatic prostate cancer, their primary doctor is a urologist or a medical oncologist. And probably on one hand, I could count the number of oncologists or urologists that have a radiation license. So it's always going to be some referral. So even me, who they just have to go down or up one floor between me and nuclear medicine, same building, just kind of very easy, do it all 10 times a day. It's still someone with a radiation license. So that's one aspect by nature with this. And then sometimes it's not going to be down a flight of stairs or up a flight of stairs. It's going to be across the street. Other places, it's going to be 10, 20 miles away. So that is one kind of a barrier. I do think that kind of on both sides, there needs to be, number one, the understanding on, let's say, the urologist or oncologist side of knowing what's going on with their ongoing ADT, bone therapy, manage other toxicities, et cetera. And then on the either radiation oncology or nuclear medicine side, that expertise for doctors that don't have, some of our expertise on, some of those specific toxicities. One thing that is different about radionuclides is there's emission that can affect clinic staff and patients' families and the public. So that, a lot of non-radiation doctors don't know that fully. So that is something that is different. It's on a high level, it's the first couple of days after treatment, and then kind of goes down with time. But, not everyone has to have every level of expertise, but I do think that it's good for all patients to have access. And I mentioned two of them. One of the current reasons for lack of access is just supply. So like with some other therapies, the world or the pharmaceutical company was not quite ready to kind of match the demand. That I think is going to be significantly improved later this year, hopefully within the next several months, but we'll see. So that's another area that, let's say the first, I'm making this up, let's say there are 200 places today that have it. The first 150 were mostly academic, but there's 50 community sites that have kind of access, but we need more than a couple hundred. We need, I don't know if we need 1,000, but we need a significant amount more. One barrier to them coming online, today in the beginning of 2023 is, well, they're a licensed site, but there's no drug available. So that's slowing things down right now. But, as an optimist, I'm confident it's going to be solved in the near future.